Without realizing it, many Americans are making choices every day, choices that increase their risk of developing cancer. And those same choices also increase their kids' risk of cancer as well. But it doesn't have to be that way. Stick around, and I'll show you two easy things that you could do starting today to protect yourself and your family. Welcome to Puppies, Pandemics, and Public Health. I am Dr. Johnny Lieberman. If you've ever wondered how your everyday choices, including what you eat, what you buy, what you wear, and the medicines you take, impact your health, the health of your family, animals, and the planet, you are in the right place. Let's get to it. An assistant professor of law, Rajesh K. Reddy, directs the Animal Law Program at the Center for Animal Law Studies at Lewis and Clark Law School in Portland, Oregon. Professor Reddy teaches international animal law, animal legal philosophy, and animal law fundamentals, among other courses. As part of Raj's advocacy efforts, he also co-directs Lewis and Clark's Animal Law Clinic. Dr. Raj Reddy, thank you so much for joining us today. I want to thank you again for being on the show and sharing your time and your valuable thoughts with us.
Thanks so much for having me, John. Appreciate it.
Professor Reddy, we're going to hit on a lot of topics today that are meaningful to you, meaningful to me, and probably meaningful to many of our listening audience. If there was one topic or one important point that you wanted to make sure that our listeners really get from everything we're going to talk about, what would that be?
It's the decisions that they make at the grocery store, at restaurants, are impacting not just their own health, but also the health of others around them. So, those decisions that we make when we're looking at menus, when we're walking down these aisles, what we put into our cart, what we put on our plates, those have real significant sort of health impacts, not just for in terms of what they do to our bodies, caloric intake, cholesterol, and the like, but also disease and the extent to which our decisions are going to increase the likelihood of the next pandemic and the like.
Wow, that's a lot. It sounds like as individuals, the personal choices we make on things like the food we buy, the restaurants we go to, they can have a huge impact on ourselves and the world around us. And can you provide maybe one example from any of those of something that might be a simple choice we can make, or maybe perhaps a misinterpretation of something that is being viewed?
Sure. When we go to the grocery store and we get to choose between soy milk or dairy milk, if you're electing to choose dairy milk, you are not only having sort of an impact on the welfare of the animals who are used to produce that dairy milk. You know, a dairy cow, for example, being artificially inseminated several times over the course of her life. And in order to produce babies who are then taken away from the mother prematurely because the industry wants that milk for the consumer. But then that decision to reach for dairy milk also implicating the number of subtherapeutic antibiotics that are fed to these animals, subtherapeutic antibiotics being fed to them specifically because the industrialized system, which is the major sort of industry or the major sort of setting in which farmed animals are reared in America, confining them into spaces that are going to give rise to the types of bacterial and other infections, other pathogens that we then are requiring to insert sort of these subtherapeutic antibiotics into their feed in order to counteract the likelihood of disease outbreaks. But then that feed and the subtherapeutics giving rise to antibiotic resistant bacteria and that threatening the livelihoods of not just the workers there and the animals there, but also our family, our friends, our communities. And so just by virtue, instead of reaching to the right for dairy milk, but reaching to the left for soy or oats or almond milk and the like, making a significant impact on the livelihoods of everyone around us. It's not such a personal decision, it's a community decision, and collective action can change the types of products that are on these shelves.
Wow, you brought up a lot of great points there, Raj. I want to try and touch on a few of them and expand a bit. In addition to soy milk, I wanted to point out for those who are not too familiar with plant-based milks, soy milk is one example. There are many examples of if you want that milk taste and that milk product, you do not have to finance or support an industry that relies on treating these cows in such a miserable way that they have to get antibiotics. And those antibiotics they can get passed on to us as consumers. So, in addition to soy milk, you may have seen it when you go to the grocery store, or maybe you haven't if you're not looking. Almond milk, cashew milk, coconut milk. There's so many other options out there. Raj, any others you want to throw in there? Plant milks? I know there's probably some others.
Sure. Almond milk, oat milk is increasingly being pointed to as one that froths really well, so it can get really creamy, that texture that people like. There are so many others. And I know at the law school that I teach at, we have some students who ask the owners of the coffee shop, like, can you please take away this upcharge on these dairy alternatives because they're better for the environment, they're better for the consumer. And so the cafe here did that. And Starbucks has also made this change now in response to these ethical and environmental concerns, but also just consumer demand. And so ensuring that the places where you're buying and purchasing these products that they're encouraging or at least putting on the same level the incentive to choose the right choice.
Yeah, that's great. And our individual choices comprise consumer demand. If you try almond milk or oat milk or something different for the first time, you realize, hey, I like it. Maybe you'll share that information with your other family members and friends. And that's what drives consumer demand in part. And the market is listening. Some of what we're going to talk about will involve regulation and or laws, but also there's a large component of consumer demand. We can make individual choices that let the market know, hey, this isn't what we want. We're going to stop buying this and shift to buying this. So that's, I think, a great example. And there's many choices out there. If you don't like oat milk, try almond milk or soy milk. It doesn't have to be cow's milk. Back to cow's milk, I think there's something you touched on, which may be obvious to you. It was not obvious to me for a long time, but it's important to bring up to increase awareness. To make milk, cows have to get pregnant. And it sounds kind of obvious saying it, but I can speak to my own ignorance. And I'm a doctor, an MD, but I spent most of my adult life, certainly all of my childhood years, drinking cow's milk. And that idea never crossed my mind. It's milk, comes from a cow. And the process is, as Raj mentioned, the cows have to get pregnant, and that's almost always, if not always, done through artificial insemination. And if you think that's a gentle process like a human female might undergo when she goes to her OBGYN to get artificially inseminated, it's not. Think of the most violent way you can think of getting artificially inseminated. And that's probably what's going on most, if not all, of these dairy farms. The motivating factor is profit. It's not animal welfare. It's not, let's be gentle, let's be sure we don't harm the cow. It's let's get this bull semen and let's artificially inseminate and get these cows pregnant as quickly and efficiently as possible because it's about putting out product as cheaply as possible. So these cows, they get artificially inseminated, they go through pregnancy, they deliver their babies. And what happens, Raj? You want to share right after the baby calves are delivered?
Sure. And they immediately bond with their mothers in these settings. In these really terrible settings, it's one of the few sort of comforts that these mother cows have, this bond with their new calves. And I'll say if it's a male calf, that calf is not worth anything to the dairy industry. And so that calf is basically taken out after a few days and tied up. And this particular practice is so that its muscles won't develop because that calf will soon be killed and sold as veal, which you could also find at your grocery store and on a menu at certain restaurants. And so those male calves from the dairy industry, those are not the types of cows that you are consuming if you're consuming beef that comes from a different line. And then for the female calves who are born, they are kept with their mothers for a few weeks. And at that point, they're taken away from their mothers. And it is as violent a separation as it sounds. And there are a number of psychological effects on the newborns and on the mothers. I was reading a number of articles that documented what this practice is like, but one in particular that was written in this rural community was trying to get the community to not worry because the screams that they were hearing at night was just a quote unquote sort of natural process of taking these calves away from their mothers who were screaming to be reunited with their newborns. And so it just really, I think, attests to, I think, the violence of that separation, but then also the psychology that we have about how to not worry about that or don't distress over what's happening here when we really should be distressing because it's distressful to everybody involved.
Yeah, thanks for expanding on that, Raj. And then as soon as the female cow is able to become pregnant again, I think normally she goes through the whole cycle again, the violent cycle, getting pregnant, having her babies taken away, and then she does it again. And then after a certain number of cycles of that pretty horrible life, what happens to that mama cow, Raj?
The dairy line of cattle, they are not the type of beef that most consumers eat. And so these cows, their bodies have wasted away by the sixth, seventh, eighth, ninth time. And so sometimes that animal is killed and slaughtered for food, but not necessarily human food. The industry is very good at ensuring that they maximize profits and that dairy cow's body might be turned into food for a dog.
Quite a miserable life going on behind the scenes that was hidden to me for a while. And now I know about it and I make different choices. And the other comment I wanted to put in there and emphasize is if you're thinking, oh, they're just a cow, taking their calves away, not a big deal, they're just a cow. I think most of us are familiar with the concept of maternal instinct in humans. That extends to probably all mammals, if not all mammal species, and maybe even beyond. I don't know enough about the veterinary world beyond that. Raj may be able to comment, but that maternal instinct, and I'll just give you an example. Almost everybody knows if you lived anywhere near the woods or rural, you don't want to go anywhere near a bear cub, right? Why? Because everyone knows that if there is any perceived threat by that cub's mom, they're going to come after you and they are not going to stop until their baby is safe. That maternal instinct is in bears and it's in cows. It makes sense that that is a conserved trait among all animals for survival of the species. So if you think the mama cow is not suffering in addition to everything they've gone through when they have their calves taken away after a few weeks, you're wrong. It's probably very similar, if not identical, to that maternal tug that you feel when you have your baby as a mother.
Yeah, and I'll add there are documented instances where this cow has seen this farmer take away her calf not one, not two, but three or four times. And the next time that this farmer is coming for her newborn calf and attacks the farmer in order to protect that calf, just demonstration that these animals genuinely care about their offspring and will do whatever they can to protect them.
We talked a bit about cows, Raj, in the dairy setting. How about cows in beef production? Are their lives any better?
You know, it's really just a variation on the same theme. Beef cattle are transferred into these sort of large feeding lots where they are oftentimes these large feedlots, food is brought to them, the manure is there, the urine is there. Sometimes it's a quarter of the way up there. So, really unsanitary conditions. These industrial producers are producing these animals at such a significant scale that very little attention can be given, can be afforded to the cattle in these settings. Oftentimes, these cattle in these lots, they do have sort of access to air, but that air is air that they're breathing that contains sort of the taint of that manure, that urine, and it's not healthy. And surrounding communities likewise suffer from those harms as a result. So, again, really just a variation on that same theme.
Yeah. So I want to create that image. You go to the grocery store, you buy a nice package of beef. It's red. It looks nice and clean. It's packaged. Maybe there's a little happy cow on the label, smiling cow or something like that. Maybe a picture of a barn. That is the complete opposite of the reality. And these animals spend maybe their entire life trapped in their own stool and urine. It coats their skin. It gets mixed into the food sometimes that they eat, and they have this stool coating them. And as we're going to transition perhaps to transmission of diseases to humans, the stool is loaded with bacteria. The animals from there, they go to get slaughtered and they're processed up, they're hacked up so that they can be put into these nice packages that we call beef. And we have many of us know that you're supposed to cook your beef well done, thoroughly, right? And why is that? I want to draw the link here because it was not obvious to me for a while. Contamination rates of ground beef, turkey, chicken in grocery stores are well north of 50%. They're loaded with bacteria, and I've always considered that normal. And in our society, in our grocery stores, that is normal, right? You want to get your raw meat, your raw animal flesh, you keep it separate from your vegetables or anything else that you can eat raw, because the probability is it's contaminated with bacteria, but the bacteria get there from stool. So if you think these animals are super cleaned before they're packaged, unlikely. They're supposed to be hosed down, I think, as part of the process. But to me, it's evidence that the filth and the stool that they've been living in nearly their entire lives makes it to the package in the grocery store, despite how clean and nice it looks and what the package may look like. You can kill the bacteria with cooking, which is why it's recommended, but it doesn't change the fact that it got there because it's contamination of their stool. And so throwing that into the mix for me as someone who ate meat and dairy most of their life, almost that fact alone makes me not want to eat it anymore, putting aside all the welfare issues. To me, it's just disgusting. You're eating remnants of stool. So just wanted to expand on that one point that Raj brought up.
Yeah, absolutely. And I'll just add the subtherapeutics that are added to their feed that's also in the product that you're eating, also the hormones that they're given to grow bigger and faster. That's also in the final product. It doesn't go away. Just really thinking about what am I putting into my own body and what concerns should I have around that. And there are countries where the prophylactic feeding of these subtherapeutics, it's banned for this particular region. We don't. It's not good for the animals. It's not good for the final product. It's not good for the humans who are going to be consuming this. And so there are regulations around it. And we just don't have that here in the US, not like we have in other countries.
That's great you brought that up. I believe the statistics are somewhere around 80% of all antibiotics consumed in the United States are for non-veterinary animal use. So, Raj, you want to share subtherapeutic antibiotic doses, how bad that is?
What I tell my students when we cover this in class is that this really led to the industrialized nature of animal agriculture as we see it today, because you could control for bacterial outbreaks, at least in theory, you could put greater number of animals in more confined spaces. And this led to the confinement systems, that architecture that we see today. And the real irony is that we've built this architecture to confine animals, or that allowed us to confine animals in all of these spaces, and that then required us to dock the tails of pigs and cut off the beaks of these egg-laying hens so they wouldn't attack one another in these settings because they're so tightly confined. But that architecture basically now requires these cages, these buildings, these confinement settings. It actually requires a subtherapeutic administration of these antibiotics. And so we've basically come into this sort of full cycle. And it's frustrating, but also just illogical because it's, again, giving rise to these drug resistant bacteria that are harming workers, that are harming the animals. I'll mention too that I think it's the statistic is something like 7 out of the 10 drugs that we feed to animals are medically important drugs or for humans. And so we are basically compromising the effectiveness of these drugs that are medically important to just keeping humans alive. And so, just to go back to that sort of initial scenario, when you have a decision to make in the milk aisle, you can choose the dairy milk, which is going to prolong and promote this type of practice, or you can choose a plant based milk that will allow us to end this cycle.
Yeah, thanks for expanding on that, Raj. Putting aside the animal consequences, from that, there's human consequences to this as well. As you all know, I've practiced infectious diseases for many years. I've made a living in part on seeing patients with antibiotic resistant infections. And there's a direct link between these antibiotics being fed indiscriminately to farm animals for the reasons Raj just touched on. There are antibiotics in your food supply. Perhaps you don't want to think about it like that, but there are. If you eat meat, it's in there, as are what happens when you feed antibiotics indiscriminately to animals or humans. Some of the bacteria that you don't kill become resistant. And so those resistant bacteria are also in the animals. So you've got antibiotics and you've got antibiotic resistant bacteria, and you're consuming that. So that's a huge public health problem, which has been recognized. Neither Raj or I are the first ones to recognize this. It's been out there for more than a decade, probably even longer than that, but practices aren't changing. However, you can take steps as an individual. As Raj just mentioned, you can choose an alternative to dairy. You can choose an alternative to that meat or chicken that's been just loaded with antibiotics and is going to pass antibiotic resistant bacteria to you, so that if and when you do get an infection, maybe it's going to be harder to treat. While a lot of us are familiar with infections that come from outside, COVID, influenza, a lot of viral infections, there's this whole world of infections which people get from themselves. You've heard of staph infections, MRSA perhaps. Those are bacteria that typically live on your skin or inside your nose. And when it gets access to a different part of your body, for example, if it's on your skin and you get a cut, that can get a secondary skin infection. That's getting an infection from your own body as opposed to picking up influenza from elsewhere. Now, if you're consuming bacteria, potentially drug resistant bacteria from the animals that you eat, as well as antibiotics that are in there, that's just increasing your resistant bacteria that's in your body. If and when you get an infection, you could have one that's going to be more difficult to treat. There's even a category of MRSA or methicillin resistant Staphylococcus aureus classified by the CDC, a Centers for Disease Control, which was not present, to my knowledge, 10 or 15 years ago. They often break down MRSA or MRSA into community acquired and hospital acquired or facility acquired. There's also another category called livestock-associated MRSA or LA-MRSA. And that developed as the recognition that these farm animals are getting MRSA. And there have been documented cases of people with close contact, mostly farm workers, but sometimes the family members, the children of the farm workers, because it can easily be passed from person to person. The rates of MRSA in these communities of otherwise low risk people for getting MRSA are significantly higher. Emergency room visits, higher. The workers are significantly at risk. If you even reside in the area and you're around this community, you're at risk. And if you're buying these products, you're putting you and your family at risk for picking up bacteria you would not have had before, resistant bacteria that are more difficult to treat. And so you have choices with how you want to protect yourself and your family with the food products that you buy.
I will echo all of that. But when we're thinking about these highly confined settings where animals are basically in these cauldrons of contagion, where these bacteria and viruses are mutating, the most sort of virulent strains, the ones with a high mortality rate, are the ones that are able to thrive in these environments. Because if you imagine animals, even chickens out in a sort of a small sort of family farm where they have space, one might get infected that virus or that bacteria. If it's going to survive, it needs to keep its host alive for a significant amount of time before it can be passed on. But in these sort of tightly confined CAFO settings, that's just not the case. It can kill its host in a very, very short amount of time and also be transmitted to the next host and the next host and the next host. And so, again, thinking about the types of viruses and pathogens more broadly that can survive in these settings and thrive in these settings, and the ones that workers are introduced to and receive these sort of infections from, and those passed into our communities. It's crazy to think that we have basically cultivated these types of production facilities that cause all of these problems.
I love your word cauldron. That sums it up really well, the way this system is. I read a really exciting, interesting paper by lead author Masiello out of University of Miami, which was in the shortly post-COVID area, talking about this exact issue. She has a line from that paper that says something to the effect of, if you were to design a system on purpose with the goal of spreading pathogens, bacteria, viruses, with the ability to mutate and become more lethal and more easy to spread, it's hard to imagine something worse or something more destructive than the current system we have, where animals are kept in very tightly confined conditions, trapped in their own manure, poor ventilation, and the high stocking density. It just facilitates transfer. In contrast to what you mentioned, if you have pasture animals out, the density is significantly less. They have access to fresh air, access to sunlight, which is known to reduce the infectivity of viruses, including bird flu. So if one animal gets infected amongst 500 that are out on the free range, it's not going to pass along to every single animal and wipe out the herd. In contradistinction to the factory farm model, where if you introduce bird flu to one chicken, for example, the attack rate is close to 100%. And so that's why if one animal gets infected, the standard practice now, you slaughter the entire barn or the entire facility because it's going to spread. So that's a major difference in one intervention that could be done. Getting it to happen, obviously, has got huge burdens in the way. But if you were to take animals out of these facilities, put them in a pasture, they would have a much better life until their time of slaughter, and the risk of disease transmission is significantly less. So that's another model which is by far the minority for a variety of reasons, but that's one way to combat it and get around, which is not being done largely. We're getting close to the end here, Raj. I want to bring up one more point in the disease transmission. And that's, we've talked a bit about infection and antibiotic resistant bacteria and transmission, but the other one I want to talk about is cancer. And most people don't think about that too much in association with livestock. But there are significant risks both to the products of these farms in terms of causing cancer, as well as the facilities themselves. We've got just a few minutes left. Raj, do you want to touch on either of those?
I know there have been a number of studies that correlate the cancer rates with the consumption of animal products. The studies that I can think of, particularly red meats, I bet you could speak to some of those studies better than I could.
So, for those of you who are still unaware, consumption of red meat increases your risk of cancer. Fact. The data behind that conclusion are as strong as the link between tobacco and lung cancer, as strong. And similarly, processed meat, red or white, also causes cancer. So what are we talking about here? We're talking about bacon, talking about ham, sausage, ground beef, the hamburger meat that you buy, the steak. It's all linked to cancer. It's a cumulative effect, like drinking alcohol and cancer and tobacco and cancer. The more you do it, the greater your risk. Just as one example from this study from 2015, so about 10 years old, from the International Agency for Research on Cancer, so-called IARC, looking at a large number of studies, this international working organization concluded processed meat, it increases your risk of colorectal cancer by 18%. 18%. So to me, that's staggering. And anecdotally, I've treated lots of cancer patients over my career because they get infections routinely. And I'm seeing colon cancer in younger and younger people. It was typically thought of as an older person's disease. Now it's not so much anymore. And is it because of this? Speculation, but there's clearly a link. And so if you're buying these products, if you eat them every day, if you're feeding ham and deli turkey and bacon to your kids and beef every day, it's important to realize you are increasing their risk of developing cancer. And most people aren't aware of that. Perhaps if you know that, maybe you'll make different choices. And this is publicly available information. You could look it up yourself. Again, it's the IARC, International Agency for the Research on Cancer. And it's not just from the consumption. The risks for cancer are real for living in proximity to these facilities, these factory farms, as well as if you're a worker there, the risk is also great. And it's also been observed higher risk in the children who don't even work there, who just live nearby. Children of workers in many of the facilities have higher rates of cancer, including brain cancer, leukemia, lymphoma, terrible diseases for anyone to suffer through, much less a child. So you have choices to make, and hopefully you have a little bit more knowledge now in terms of the factory farms, dairy, beef are primarily what we focused on here. The output from them directly causes harm to you, including transmission of infection, resistant bacteria, and the higher risk of cancer. And if you want to protect you and your family the most, if you do live near one of these factory farms, you might want to consider relocating if that's a possibility. If you're not aware that the fact that you live a couple of miles away from a factory farm, you might be putting your children at risk of picking up MRSA or getting brain cancer. Is that enough for you to consider moving? I don't know. That's up for everyone to think about on their own. Raj, we're coming up to the end here. Are there any other final comments or thoughts you'd like to share?
Just want to thank you for having me on your podcast. Just to echo, I think, some of your comments and encourage listeners to do the research and to consider the real impacts on their own health, the health of folks they might be purchasing these products for, but also on the surrounding community, because our decisions have these significant impacts beyond ourselves, our homes, also on the environment more critically or more globally. Really compelling studies observing the relationship between some of these industrial animal agriculture and climate change as one of the leading sort of causes. And so, again, one of the best decisions that anyone can make is to reach for the plant-based option over the animal-based option. It's better for your family, better for the climate. It's more efficient, and I think it's just the right choice in the end.
Great. Thank you, Raj, for bringing that all together for the end there. I want to thank you again, Raj, so much for your time, for your valuable insights and thoughts on these very important topics. Hopefully you glean something from this, from our discussion, and you will feel better prepared for making more informed decisions going forward. Thank you for listening. If you like this, click on the like button, follow and subscribe. Thank you for listening. Thank you, Raj. Thanks for listening. These conversations aren't always easy, but they're important and worth having. Take what resonates, ask questions, and keep learning. Find us on Doctor Podcast Network or wherever you get your podcasts. The content of this podcast is for informational and educational purposes only. It does not constitute medical advice nor legal advice, and it cannot replace professional consultation with your doctor, lawyer, or other licensed expert. Always seek guidance that's specific to your situation.